We had a shooting last week and they still won't give us bulletproof vests.
All you have to do is say that you are committed to that the people who work in your buildings, who keep them safe, who keep these multi-million-dollar buildings safe, that when they work in your building, they should have health care. That's all you have to do, is step up, make that commitment. So we've been saying all day, today's a one-day strike to show that we mean it. But we are ready. Because if it has to get bigger, then it's gonna get bigger.
Well, today, what this is really about today is that in the end, these are subcontracted workers. So the security companies are hired by the building owners. And so the message to the building owners and to the commercial real estate community is that you have the power to fix this, because in the end, they are the ones who pay the bills. So what they need to send the signal that they want the people who work in their buildings and keep their buildings safe to have health care. Yeah. The average wage is a little under $12. And when you factor in healthcare costs, literally our members have to make a choice. Either they have healthcare or they pay the rent, and you can't make that kind of a choice. Just of the 800 security officers, less than 2% have family healthcare through their employer. Just 30% have any healthcare at all. So you know, there's no way that people can work 40 hours a week. And we as a society can say that it's okay that you don't have health care. Yeah. Well, this is a part of, we are nationally, we're bargaining different contracts. Today in Seattle, there are actions because they're bargaining their contract, but we've actually, you know, what's interesting is that we actually already settled a contract in San Francisco, another in Los Angeles, that achieves the very standards that we're asking for here. Yeah. Health care for individuals and affordable family health care by the end of the contract.
My name's Mike Kipka. I work at Block E in downtown Minneapolis.
And tell me why you're out here striking today.
We're out here for several reasons. We're trying to get a contract settled, and the companies don't want to do that. We're asking for health care, which is a big, important issue for us. 98% of our members can't afford the family health insurance that they provide. But we're also out here for public safety. It's a big concern to all of us. And we're trying to raise the standards so we get the better training and equipment that we need to do our jobs. I mean, we face several dangerous situations. We've recovered guns off people. We had a shooting last week and they still won't give us bulletproof vests. And it's ridiculous that they don't want to give us something that we need to stay safe and so we can keep the public safe.
So why are you striking?
We're striking so we can get better pay, better health care.
And the pay that you're making right now, it's not enough?
It's not enough.
Uh-huh.
And I don't think it's going to be enough the next couple of years coming if we don't do a change of race.
What's your name?
My name is Ahmed.
What company do you work for?
I work for American Security.
When I say stand for, you say security. Stand for 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 security. What do we want? Health care. What do we want? What do we want? Health care. What do we want? What do we want? Health care. What do we want? What do we want? Health care. What do we want? What do we want? Health care. What do we want? If we don't want no health care, if we don't get no health care, we don't get no peace. If we don't get no health care, we don't get
Oh,
that it is?
I mean, we shouldn't be bargaining about healthcare. That should not be something that gets solved at the bargaining table. We understand that anything we do is piecemeal anyway, because we need national healthcare reform. Unfortunately, where we are right now, the only way we can win healthcare is at the bargaining table. But we understand that this is one step, that if people across the country are facing this. This is why, this fight is not about just the security officers, it's about the community at large, and it's about the country we live in.